Thinking about circulation, we like to think of ourselves kind of like fancy plumbers. So just treating all the pipes throughout the body. So a vascular surgeon treats all the blood vessels in the body. So that includes the arteries, which carry blood away from the heart, and the veins, which carry blood back to the heart, and the lymphatics, which are the small channels that carry this kind of protein-rich, milky fluid throughout the body. And we like to think of ourselves kind of like fancy plumbers. So just treating all the pipes throughout the body. So that's everything from the tips of your toes all the way to your brain. We treat that all, and any disorders in those. The reason blood vessels are important is that they carry oxygen, and oxygen is what the body needs to survive, and it's used for energy. So if any part of the body is deprived of oxygen, then it can start to die. The goal is to always maintain that circulation of blood throughout the body. So in the arteries, we have what's called atherosclerosis, which can cause blockages in the pipes. And that can lead to, oxygen being deprived, whether it's for a long period of time or a short period of time. That can lead to tissue loss, whether it's on the tips of the toes or the fingers, or gangrene. And then also atherosclerosis can lead to clots forming. The other main issue, if you think of the plumbing system, is if the pipes burst. So sometimes the arteries can pop, and that would most commonly from aneurysms or dissection. And that can lead to acute or emergent loss of blood to a certain part of the body. So that's from the arterial standpoint. In the veins, you can have slow blood moving back, like a sewer, for instance. And in the legs, you can start to, when the blood sits there, clots can start to form, and those can cause massive swelling in the legs, or varicose veins, bleeding, staining of the skin. And another emergency that can sometimes happen is when those clots can go up towards the lungs, and that would be like a PE or pulmonary embolism. And if that occurs, we would need to go in and suck those clots out of the lungs. Atherosclerosis is change in the layers of the blood vessel wall. It can start to harden, and that can be due to a combination of factors. Most commonly, high blood pressure can lead to thickening of those layers. Sometimes can cause tears in those layers that can go down a cascade where clots start to form. And clots can shoot down to other parts of the body, so that can, if there's blockages in the neck, that can cause strokes. Blockages in the belly area that can cause clots going into the belly area, causing belly pain and sometimes the intestines dying. Clots going to the kidneys that can cause loss of kidney function, as well as high cholesterol that can deposit cholesterol, causing calcium formation. And some people that have particularly significant atherosclerosis are diabetics. Diabetics can have hardening of those small blood vessels, particularly down in the feet, below the knees, as well as the kidneys, etc. So people that have bad diabetes can have bad atherosclerosis. And then one of the more preventable things that can cause atherosclerosis is smoking. Smoking can really affect the blood vessels, so we always encourage people to not smoke, and if they are smoking, to stop. Yeah, aneurysms are basically a disease process where the artery will start to balloon out or widen. And depending on where the aneurysm is in the body, it can widen to the point of bursting, or it can widen to the point where a lot of clots will form inside of it, and those clots can go down to the legs. But most often more concerning is the bleeding risk. So if the aneurysm in your belly were to rupture, then you could, someone could bleed to death very quickly. And that's one of the most major vascular emergencies that we treat. A big component of aneurysm formation is genetics. So a lot of times people have aneurysms running in their family, or they've had a family member that died of a ruptured aneurysm. So we work them up, and sure enough, they have aneurysms somewhere, either the belly or the legs. As well as high blood pressure that can cause aneurysms to form or get worse. And smoking is also one of the risk factors for aneurysm formation.